Americans want to understand. They want to know what the real skinny is with health care reform. What are we really doing here in Congress? There's a lot of numbers being thrown around. The Democratic leader announces last night that the number, if you will, is $849 billion. But then you have the Republicans stand up and say, well, when you actually take into account when the spending starts and when the taxing starts, you're talking about $2.5 trillion. So the American public is saying, well, which is it? What's real? How much is this costing me? And then when they hear that, well, this is a deficit-neutral bill, the average American is saying, well, what exactly does deficit-neutral mean to me? What does this health care reform bill mean to me and my family? What does it do to my premiums? Well, unfortunately, as my colleagues have just said, this is kind of a bit of a rerun in terms of the impact to your premiums. From best we can tell at this point in time, and like the rest of you, we are still getting up to full speed in analysis of this behemoth, but our reality is that the American public is still going to be facing increased premiums. The taxes that we talked about on small businesses and on individuals, when we looked at the House bill versus the Senate finance bill, well, that tax piece is still going to be there on the American family. And the cuts to Medicare, to the tune of about $500 billion, are still in place. And when I talk to my constituents and I ask them the question, do you believe that we can really handle a $500 billion cut to the Medicare program without that impacting your access to a provider who will see Medicare-eligible individuals, or without impacting the quality of the care that you get? They look, Lisa, you got to be straight with us. Well, this is going to be our opportunity as Republicans in the Senate to stand up and be straight with the American people about what really is in this health care reform package. To let them know that when we talk about this Medicaid expansion, yes, we will get more Americans on those Medicaid rolls, but what happens after that period when the federal government is no longer absorbing the cost for that expansion, and it kicks back to the states? What happens to those individuals at that point in time? People need to fully understand that if this measure goes forward, you're going to be taxed a full 5 years ahead of the time that you're going to be seeing any of the benefits. The benefits don't start kicking in until 2014. Well, you're going to enjoy the opportunity to be paying for that several years before you see any of these things that have been promised to you about the insurance reforms, making sure that we are no longer denying individuals for pre-existing coverage, or the prevention and wellness pieces that are in this proposal. So be aware that that is out there. Recognize that there are some provisions in, excuse me, I should take that back. There are absences in this legislation that could help save us money, that could help lower that cost curve. There's nothing in here that would relate to the junk lawsuits, the medical malpractice and liability reform. So we will have an opportunity in the coming days to let the American public know what it is that is in front of the Senate right now, and we'll have the opportunity, I hope, to scale this back, to pull it back, and then be able to address the issues that we care about in terms of delivering affordable health care to Americans on a more reasonable basis.